Hey, how you doing? Today we are going to take a look at sinus arrhythmia. So if you had the ability to identify what a sinus rhythm is, and then take a look at what a sinus brady, sinus tach, all those wonderful things, you are not going to have or be disappointed in trying to interpret a sinus arrhythmia. So let's go ahead and get started. And of course, our first thing is going to be, let's take a look, is this a readable strip? And I'm reading through here, I can identify P waves, QRS complexes. Therefore, I'm going to identify this as, yes, it is a readable strip. Next thing I want to take a look at are P waves. Are they present or absent? So we'll just go ahead and circle down through here. And it appears we do have P waves. Okay, so we do have P waves, and they are present. Is there a P wave for every QRS? And if we come down through here again, we will see that there are P waves for every QRS. And we're going to reverse it and make sure that we have QRSs for every P. Okay, so we can answer yes to both of those questions. And we'll go ahead and erase all this. And now we need to bring in our calipers to be able to identify the PR interval and find out if things are regular. So all we need to do here is we're going to hit a couple areas. First off, we're going to just mark our P waves. Okay? We're going to mark our P waves. And now what I want to do with this is I'm going to go ahead and move this down. And I notice that it is already irregular. And then I notice that it kind of looks like it goes back into some things here. So we'll have to keep an eye on that. So it is definitely irregular. And now I'm just going to bring my calipers back in here. And I'm going to mark off where, let me move this down a little bit so I can get a better view for my PR. And it looks like my PR interval is probably going to be within normal range. And yeah, it looks like we are at about 4. So that is 4 blocks, and that PR interval is going to be at 0.16. We find out that this was irregular, and we'll come back to that here in a minute. And let's see if our PR interval stays the same. And it so far appears that our PR interval is staying consistent. Okay, so our PR interval is consistent. And because we know that it falls within a range of 0.16, it falls within normal pathways. So we now know that this is an irregular rhythm. It is irregular both on the aspect of the QRS complex as well as the P waves, or I'm sorry, as far as the atria as well. So we can go ahead and mark things here. Now, if you recall, we need to make sure that in a 6-second strip that we have accounted for P waves and QRS complexes, because that is where we're going to be able to identify what a rate is, because it is irregular. Additionally, if you recall, we had a couple choices for irregular rhythms. Are they regularly irregular? Are they irregularly irregular? Or are they occasionally irregular? So if you take a look at this, and we'll just answer off that part here about that regularity issue. I can almost group what looks like these two. These here, and actually could probably bring that right out to about here. And then you notice that we have another group that appears here. So it looks like these three, and we'll just make sure, right? So we're going to bring our calipers back in. Okay, and again, it doesn't matter where we are measuring things here for on our calipers, as long as they are consistent at the same wave all the time. Okay, so we're going to bring that down. We see that those are okay. And we'll bring down here. And almost looks like, yep, see how they fall back in line here? So these three are the same. And then we're going to see that these in here are going to probably be the same as well, but I need to make my paper a little bigger. And these appear to be in order as well. A little irregular from these three to this one. So I bet you we could take this one. I can see the way that it is actually sitting there right now. Could probably cause a little bit of an issue for us, but that is following a pattern. Okay? So that's following a pattern. So because this is following a pattern, we're going to say that this is regularly irregular. And again, you can see that there is a pattern that has emerged here. The closer the QRS complexes are, means that this is faster. The further apart they are, means that the rate is now slower. And then you can see here that it gets faster again. So this is that pattern. We're looking at that regularly irregular pattern. It's going straight through. Now that doesn't mean that we're going to have problems with rate for that 6-second strip. So that means that we have to account for 30 blocks. So let's go ahead and mark. Okay, so we have one block here. Okay, so there's 3 seconds, 60 seconds. Okay, so it becomes important to make sure that you understand that we've now just gone ahead and marked this. So we're going to count here. It's 1, 2, 3, 4, 5, 6, 7, 8. So we counted in a 6-second strip 8 QRSs and also 8 P waves. So because we have done that, that means that we're going to take 8 and we're going to multiply it by 10, and that now means that we have a rate of 80. So we have an atrial rate of 80, and we have a ventricular rate of 80. Okay, so I got a whole bunch of stuff up there. Let me try to erase some of this for us. Makes it a lot easier then. Okay, don't want to erase everything though. So now we're going to come back in here and we need to take a look at what our QRS duration is going to be. So I'm going to bring this up here. Okay. So our QRS duration is going to go from the beginning of the Q wave to our QRS, so right to about here. So let's see what that is. And as I take a look at that, it looks like it's at about 3. So if it's at 3 blocks, that means that it's at 0.12. What we know is that anything that is greater than that 0.12 is going to be coming out of abnormal or not following normal conducting pathways all the time. So that means that it could be coming out of the ventricles, or it could be meaning that there is a problem somewhere in that intraventricular septum. Right? We could have a problem that is there. So we'll take a look at that a little later on. So based off of this, we have everything follows. So this is normal. And our atrial rate is also normal. So really, if you take a look at this, the only thing that is considered to be abnormal is right here. So what's happening here is that there is a pattern that has developed. This is a wave that comes up here. You see that it gets, so here we said in this area, it got a little faster, and then it got a little slower, and then it got faster again. So in these areas, you can see that things actually break up. Because of that and everything falling within normal conducting pathways, we are then going to call this a sinus arrhythmia. Okay, so it's a sinus rhythm because we have a P wave, and it is going to be an arrhythmia. Okay, so a sinus arrhythmia, really, some of the books are going to tell you that there's a couple different things, or really two areas that you're taking a look at, that this could be related to respiratory rate. So somebody is breathing. And because the EKG leads are on our chest, and you know that you're going to be moving up and down every time you breathe, it is picking up the pattern of your respiratory rate. For us, we have to take this into an account and take a look at the patient. That is the ultimate goal. Take a look at the patient, but usually, this is related to a respiratory pattern. For us, that's one of the big keys. And then look at your patient. This is the key. Every time you go to take a look at a EKG, you have to put it into context with what your patient is about. So this is sinus arrhythmia. See it once in a while. Not a lot of frequency that personally I have seen. I have seen it, but again, you may find this in pediatric patients, and you may find this in some older population because of the size of their chest. Okay, I hope that helped you out, and there's a sinus arrhythmia. We'll see you on the next one.